Palpitation could be attributed to commonly is hyperdynamic circulations, particularly when people have fever, anemia, the heart rate will go up, or simply due to sympathetic overdrive, like the one before, you have shots of adrenaline in the system, your heart rate will go up, and you feel a bit of palpitations. Well, we will talk about what we want to talk about today is about the cardiac arrhythmias, which may influence our managements to the patients. And not surprisingly, that as mentioned before, statistically, 16% of all clinical complaints that we might face are due to palpitations. And it has got about 1 to 1.6% yearly mortality, and especially if it's associated with atrial fibrillations, you have about 1.1% risk of stroke per year. And interestingly to note that 75% of people who complain of palpitations will come back to you within 1 year of the same complaint, whether you have a diagnosis or not. Now, what people describe is crucial for us to help us to make a diagnosis. And of course, as any one of us who go through medical school, we've been taught again and again about the completeness of history takings. So the voluntary information or the questions that you ask the patients will help you to make an appropriate diagnosis. The condition of the symptoms, whether it occurs at rest, adjacent or recent illness, any associated symptoms, pay particular attention to that because it may give particular weight to the possible outcomes, durations, condition of determinations, of course, the completeness of the history, past medical history, what patient does, and of course, common association with common things that we do in coffee, tea, and smoking, as well as alcohol intake. Now, the chief complaints will give a clues as to what would be the underlying diagnosis. If they say that they have missing beats or skipping beats, that might suggest a possibility of premature ventricular contraction or premature atrial contractions. What patient feel is actually the strong contractions. It's not actually the missing beats itself. Okay, whenever we have a skip beats or early atrial or premature ventricular beats, it tends to reset the cardiac cycle lengths, and hence we have a longer period of time for the blood to fill up the left ventricle, and hence the next beat is actually stronger. So what they feel is actually the beat, the beating of the heart after the premature atrial contractions or premature ventricular contractions. And of course, when they complain about sustained bursts of palpitations or fast heartbeats, it might suggest whether it could be supraventricular tachycardia or ventricular tachycardia. And again, as we all thought, if you were to have irregular heartbeats equals atrial fibrillations, until proven otherwise. And the suddenness of the symptoms and the suddenness of the terminations of the symptoms also suggests the likely underlying diagnosis, particularly talking about SVT. They tend to occur suddenly and stop suddenly as well. And of course, the more common or more normal presentation will be the sinus tachycardia will start slowly, go up fast, and then slow down slowly. These are a few others pointers that might help with the diagnosis, particularly if you were to have some anxiety-related symptoms. It might suggest it's more likely just to be anxiety. If you were to have murmurs, that might suggest some or more sinister diagnosis of palpitations. Right, what we do next is focus on what patient complains, and we want to assess whether the palpitation itself can be a life-threatening condition or not. As I said before, pay particular attention to the associated symptoms or the past medical history that patient have. If they presented with syncope or fainting episodes, that would suggest that whatever the palpitation they have causes hemodynamic compromise and hence causes the symptoms. And of course, past medical history of ischemic heart disease,